everyone.
Hi, my name is Gabby. I'm going to be your nursing student working with you today. Could you verify your name and date of birth for me?
Cal Dahalski, 12/19/2002.
Are you in any pain today?
No.
Does your family have a history of any cardiovascular diseases?
No.
Do you have any heart conditions that you know of?
No.
No extra heart sounds, a heart murmur or anything?
No.
Okay. So today what we're going to be doing is we're going to listen to your heart and we're going to look at your upper and lower extremities, so your arms and your legs. We're going to make sure that the same temperature, that you don't have any problems. We're going to be doing a unilateral orthostatic blood pressure. So what we're going to be doing is we're going to be starting off having you lay down. We're going to have you sit up and then stand up, and then we're going to take your blood pressure 4 times. During that time, if you have any dizziness or any pain, just let me know and we'll stop. And then we're also going to be checking different pulses in your body. So we're going to begin by doing your unilateral orthostatic blood pressure. So I'm going to have you lay down and we're going to wait 3 minutes and then we're going to take your blood pressure. So I'm going to do you have an arm that you prefer I do your blood pressure on?
Okay.
Okay, so I'm going to just put this blood pressure cuff on your arm so that we're ready. Okay, and then we're going to just wait about 3 minutes for you while you're relaxed. And then after that 3 minutes is up, we're going to take your blood pressure. Do you have any questions?
No.
Do you have any pain in your chest?
I do not.
Any difficulty breathing?
I do not have COVID.
Do you have high blood pressure? Any pre-existing conditions of high blood pressure? Low blood pressure? Have you had breast cancer? Okay. A mastectomy?
Nope.
Okay. Perfect. Okay. So the 3 minutes is up, so I'm going to start by taking your blood pressure while you're laying down. So if you could uncross your legs for me and just remain in a comfortable position. There we go. There we go. Okay, so I'm going to pump the blood pressure cuff up to about 130. Okay, and for your blood pressure, I got about 102/62. So now if you could sit up for me. We're going to keep that blood pressure cuff on your arm. Are you dizzy sitting up?
No.
Okay, so we're going to wait about 1 minute, and then we're going to take your blood pressure again, and then we're also going to take your pulse. So if I could see your wrist. Okay, for your pulse, I got about 82, which is regular. It was about a +2, which means it was fairly strong, but it wasn't bounding. And it has been a minute, so we can take your blood pressure again. If you could uncross your legs for me and sit in a comfortable position. Again, I'm going to pump the blood pressure cuff up to about 130. Okay, and for your blood pressure, I got 100/62, which is still in the normal range of what we're looking for right now. And then if you could please stand up for me. And then again, I would like to ask if you're dizzy at all.
No.
Okay, so now we're gonna take your blood pressure right away. Are you in a comfortable position? Is that okay?
Mm-hmm.
Okay, and I'm gonna check your pulse again right away. Okay, and your pulse again was at 82, and your blood pressure was at 100/60. We're gonna wait 2 more minutes, and then we're gonna take your blood pressure again, and that'll be the last time that we're doing it. You're not dizzy? You're not feeling any pain? Okay. So then we're just gonna wait 1 more minute, and then we should be good to take it again. And then I would have also taken your pulse while you were laying down. So then after we take your blood pressure for the next time, I'm gonna have you sit down, and I'm gonna feel your neck. I'm gonna feel your carotid arteries in 3 different spots on both sides of your neck. And then I'm gonna listen to them. Okay, so the 3 minutes are up. So I'm gonna take your blood pressure again for the last time. You're not dizzy at all. You're not in any pain. You're comfortable and okay. So again, I'm gonna put that up to about 130 for the last time. Okay, and this time it was at 58. And that is still normal. It didn't go down too far at all. Your pulse was still regular throughout. You're not dizzy at all still?
Mm-mm.
And you're still not feeling any pain?
Nope.
Okay. So next I'm going to be feeling your neck, and I'm going to be feeling for your carotid arteries. So what I'm going to do is I'm going to just put my hand right here. And then down. And down a little more. And then I'm also going to be doing that on this side. So your carotid arteries, the pulses felt strong. I would rate it about a +2. They weren't bounding. Felt like it was good pulsations. Next, I'm going to be listening to those carotid arteries using the bell of my stethoscope. And I'm going to listen for any bruits, which it would be a swishing sound. And that's what we don't want. You could hold your breath for me. And take a deep breath out. And then hold that. And then you can take a deep breath. And then we're going to do the same thing. So if you could breathe out and hold it. Okay, and then you can breathe like normal. I didn't hear any bruits. I didn't hear any swishing sounds in your carotid arteries, which was good. So next, I'm gonna have you lie down for me. And I'm going to be feeling across your precordium, or across your chest for the precordium, and I'm gonna feel for any heaves or thrills. And then I'm also looking at your chest. I don't see, your skin color looks normal. Slightly pale, slightly pinkish. It looks symmetric. I don't see any lumps or bumps, any lesions. Do you have any tenderness in your chest? Any pain? Okay. I'm going to now look for your apical impulse. And so to do that, I'm going to be going down to your 5th intercostal. It's about right here. And I'm going over mid-clavicular. Is that okay?
No, okay.
And I'm going to feel mid-clavicularly. And I feel it. And that's good. So I found it, which is good. I would rate it at about a +1 to a +2. It wasn't very strong, but it was not faint enough that I couldn't feel it. So next I'm going to be listening to your heart. So I'm going to be listening in 5 different spots. And I'm going to start by using the diaphragm of my stethoscope. Okay, so I'm going to start by listening to your aortic pulse, which is in the 2nd intercostal, near your sternal border. Next, I'm going to be listening to your pulmonic, which is in the 2nd intercostal on the left side by the sternal border. Next, I'm going to be listening to Erb's point, which is in the 3rd intercostal at the sternal border. Next, I'm going to be listening to the tricuspid valve, which is in the 5th intercostal at the sternal border. And then I'm going to be listening to your mitral valve, which is in the 5th intercostal mid-clavicular, about where your apical impulse is. And it sounded very strong, very regular. Next, I'm going to be listening to your apical impulse for a minute, and I'm going to rate it and tell you what your pulse is there. Okay, and for that I got 82, which is again regular for you, or normal for you. Next I'm going to be listening to those 5 points again, but with the bell of my stethoscope, again listening for any bruits or any extra heart sounds. So again with the aortic, the pulmonic, Erb's point, your mitral, or no, this is tricuspid, I'm sorry. And then mitral. And then I'm also going to have you turn on your left side. And with the bell of the stethoscope, I'm going to be listening for any extra heart sounds, which would be S3 and S4. Okay, and you can roll flat again. I didn't hear any extra heart sounds, which is good. And while I was doing this, I was listening at S1 and S2, and I heard S2 near the base of your heart, which would be the dub. So your heart makes two sounds, it's lub and dub. So I heard dub more at S2, which is the dub more at the base of your heart, and lub, which is S1 more at the apex of your heart. Next, I'm going to have you sit up, and if you could put your legs over the bed. I'm going to look at your upper extremities and your lower extremities. Your facial expression is relaxed, doesn't look like you're in any pain. You were able to sit up without any discomfort. I'm going to feel your arms, just to feel the temperature of them and the texture. They feel smooth, slightly cold. Is your body normally slightly cold?
Always.
Okay, so that would be normal for you. I'm going to just feel your legs bilaterally. They're also slightly chilled, but they're the same temperature, and they don't feel dry, they feel moist, smooth. If you could put your hands flat for me, I'm going to look at the turgor. So we're checking for any dehydration. So I'm looking for any tenting in your hands, which I did not see. I'm going to look at your nails. I don't see any clubbing of your fingers, which is when the nail beds exceed over 180 degrees, and this is also good. I'm going to check the capillary refill of your fingers. So I'm going to make sure that the blood returns to your fingers within 2 seconds or less. And they do. And then I'm also going to be checking on your toes. And they've refilled within 2 seconds on your toes also. Next, I'm going to be checking a couple different pulses on both arms. So if I could see your arms, I'm going to check your brachial. And on this arm. And I would rate both of those at a +2. They're both very strong. If I could see your wrists again, I'm going to check your radial pulse on both hands. And those again, I would also rate a +2. They're also very strong. I'm going to check your popliteal. So that would be behind your knees. So if I could see that. They're both very hard to find, so I would rate that at about a +1, which means they're still there, but they're very faint. I'm going to check your post-tibial pulses, which are by your ankles. And those are also fairly faint, so I would also rate that at about +1. And I'm going to check your dorsal pulses in your foot. So to make this easier, if you could raise your big toe up for me. Well, those are actually kind of strong.
It's because you can see my veins.
Yeah.
Perfect.
So I would rate that at about a +2 because it is very strong and it's not bounding. So overall, your heart seems very strong. The beats per minute seem very regular. You didn't have any dizziness while you were having your blood pressure taken. You were able to sit down, stand up, and lay down with no problem. Your skin color looks good. You look relaxed. So all I would do is wash my hands and document. And we're done.